This is the second lecture for Chapter 20 that's covering infectious diseases of the nervous system. Now we're going to talk about the viral diseases of the nervous system. Since viruses are much smaller than bacteria, they more readily cross the blood-brain barrier. So you'll find viral infections of the CNS more frequently than bacteria. These include viruses that can cause meningitis, polio, rabies, as well as encephalitis. To start our discussion of these viruses, we'll begin with viral meningitis. These cases of meningitis of viral origin are a more common form of meningitis. The signs and symptoms of viral meningitis are similar to those of bacterial meningitis. Stiff neck, that's pretty much impossible to bend because of the pain. Nausea, drowsiness, confusion, and extreme headaches. But the disease is overall more mild than a bacterial or a fungal meningitis, and therefore patients typically run the course of the infection without severe after effects. The diagnosis is interesting because you must go beyond the characteristic signs and symptoms of meningitis. How do you diagnose if you're trying to determine the origin of infection? To look for bacteria, you do a gram stain or similar test of the cerebral spinal fluid, the CSF. The absence of bacteria, coupled with all the signs and symptoms of meningitis, allow you to draw the diagnosis of viral meningitis. So here, the absence of a visible cause that leads to the viral cause diagnosis. Due to the viral origin, there's no specific treatment for the infection except supportive care of the patient. Polio is another important viral disease of the CNS. There are 4 forms of the infection. Perhaps surprising to many is that most disease is asymptomatic. When you do have symptomatic disease, those cases range from mild disease in about 5% of the cases, non-paralytic, which is slightly more severe form of the infection, and finally paralytic polio in about 2% of all polio cases. However, for those that are affected by polio, there is a post-polio syndrome that affects 80% of recovered patients. These patients experience a degeneration of their muscles and their nervous system that occurs later, sometimes years later. This infection is transmitted via the fecal-oral route. In the past, it used to be that public swimming pools were a source of the infection. Think about it. If there's a lot of people in the swimming pool and the chlorine level isn't high enough, the virus will survive and infect people. The virus does replicate first in muscle cells, and then it moves into the neurons where it'll cause a problem. Again, treatment is only supportive care since for a lot of these viral infections, there is no specific treatment. However, we do have 2 preventative vaccines. There is an inactivated vaccine that's called the Salk vaccine, named after the researcher that developed it, and then we have the attenuated version, which is the Sabin vaccine. Currently in the United States, we have moved to using primarily the inactivated Salk vaccine. Remember, attenuated vaccines can have residual problems, and the Sabin vaccine had some documented problems in immunocompromised patients. Because of our immunocompromised population and the residual risk of the Sabin vaccine, the Salk vaccine has largely been used in place of the oral attenuated Sabin vaccine here in the United States. Remember, I talked a bit about how in the Philippines they're experiencing a polio outbreak. The attenuated vaccine through contact transmission had spread so much within the community that it mutated and became virulent again. So, while it can be very beneficial to have contact immunity available with attenuated vaccines, you have to balance the use of the attenuated vaccine with widespread vaccination campaigns to prevent large-scale spread that can allow mutations to accumulate. Endemically, meaning that it commonly circulates in the population, polio is currently only found in Pakistan and Nigeria. There is some hope to completely eliminate polio from the planet as they did with smallpox, but there is still work to be done for that to happen. It is possible. Now on to rabies, another viral disease of the CNS with a vaccine available. Similarly, With this disease, there's a characteristic neurological signs when the virus reaches the central nervous system. It progresses to seizures, hallucinations, paralysis, and ultimately death. The individual or animal may experience hydrophobia, meaning they don't want to be anywhere near water or swallow water because of the pain associated with the use of these muscles. Thus, affected animals or people may also be drooling. It's transmitted usually by the bite or scratch of an infected animal or individual, but it can just be the saliva from the infected individual that gets into a small opening or wound into another individual. The virus is going to replicate in muscle cells and then move into the neurons, where it can travel up to the central nervous system. There is no real diagnostic test except for post-mortem, after death. After death, one can examine the individual's neurological tissue for these characteristic Negri bodies. If you look at this image up at the top of the slide, this is a section of tissue from the brain of an individual, and Negri bodies are present that are diagnostic for rabies. You can treat rabies with immunoglobulin if you catch it early enough to provide the passive protection. As you already know, there is a preventative vaccine available. This is one of the very few diseases where you can get the vaccine after exposure and still generate enough protection to prevent the full disease. But treatment must be early before the disease has progressed too far. Otherwise, it's a fatal infection. It has been extremely rare where a symptomatic person is treated and recovers. It is important to provide the vaccine and protective antibodies soon after exposure to ensure recovery. This slide is showing you where some of the reservoirs of infection are found in the United States. You'll notice that in some parts of the United States, skunks are primarily the reservoir, and other parts, more on the eastern edges, raccoons are a reservoir. Most of the infections that get transmitted directly to humans have come from bats. Primarily, bats behaving very unusually, like landing on a person, or when a bat allows a person to pick it up. These are not normal behaviors and a sign that a bat has something wrong. These animal reservoirs out in nature can transmit the infection to our pets, and then pets can transmit to humans. So the approach that a lot of societies have taken is to ensure that our pets are vaccinated against rabies, so that cycle of infection is broken before it leads to human infections. It works. Not only are our pets protected against the disease, so are humans. There are only a very few rare cases of human rabies in the United States, and those typically come when individual directly contacts infected wildlife. We'll next talk a little bit about a protozoal disease of the central nervous system. The disease is African sleeping sickness. This is caused by a protozoa that might look familiar to you if you remember drawing this guy in your blue book. This is a trypanosome, and it causes African sleeping sickness. It gets its name from the last phase of infection. Initially, a little fly called the tsetse fly, a biological vector, bites the individual and transmits the organism. A person would first develop a local lesion, but then the organism moves into the blood and they'd experience fever and swelling, which is not that unusual, but then your symptoms will progress to get meningoencephalitis, a very severe brain infection that can lead to coma and death. The coma is where the African sleeping sickness gets its name. How you diagnose this infection is to observe the trypanosomes in a stain of the blood or lymph fluid or cerebral spinal fluid. You possibly might even see it in a tissue biopsy since the organisms might be circulating. There are drugs available, but like a lot of protozoal infections, it's a difficult organism to treat and get rid of. This slide shows the life cycle of the trypanosome, and don't worry too much about the details. You will want to remember, however, that the tsetse fly is the biological vector and the invading organism or the causative agent is trypanosome and what it looks like, and also that it leads to coma and death. This last organism of the chapter that we will cover is amoebic meningoencephalopathy. This is the brain-eating disease that you might have heard about in the news. See this picture down here? This is the amoeba that you can pick up from contaminated water. There are two types of amoeba that might result in this type of infection: acanthamoeba and Naegleria. These are the two amoeba, and amoeba are protozoa. These two can cause infection of the brain, although it's very uncommon. A possible route of transmission is when people enter contaminated water, like a lake. The amoeba might enter through the eyelid or potentially by inhalation and gain entry through the nerves in the sinuses. There has been a couple well-documented cases of individuals acquiring the infection through the use of a neti pot, which is shown down here. A neti pot is something that is used to flush the sinuses out, especially by people that suffer from allergies. People will wash their sinuses out every day to keep the allergies at bay. The CDC is now recommending using only boiled tap water in the neti pots because of these documented cases of people that acquire the protozoa causing amoebic meningoencephalopathy. Because they were living in the pipes in their home, the organism were literally introduced into the sinuses by the individual attempting to wash their sinuses. This infection is very difficult to treat and almost always fatal. The drugs used in treatment have had very limited success, but thankfully there's not very many cases. There was only 32 documented cases over a 10-year span. Although these types of cases get a lot of press coverage because they're scary, this is not a very common infection. Prion disease is caused by an infectious protein, and we have talked a little bit about that already. There are various prion diseases, including variant Creutzfeldt-Jakob disease, which is a human disease, scrapie, which is a sheep disease, and mad cow, which is obviously a disease of cattle. These are infections that cause a spongiform encephalopathy, holes in your brain tissue. So if you look at the slice of brain, you can see these vacuoles or these spaces that make the brain look like a sponge. Humans contract VCJD by eating contaminated beef from infected cattle. In the 1990s, there was an outbreak of mad cow in the UK, but at the time they did not realize that mad cow could be transmitted to humans. These cases didn't get much attention, but the epidemic amongst the cattle was becoming widespread, and eventually some sick cattle were used in human food supply. This led to a rise in variant Creutzfeldt-Jakob disease that peaked in 1993. Once the epidemiologists realized the link between the human and cattle disease, the government required almost all complete elimination of the entire UK population of cattle. It was only then that the epidemic ceased and the human cases fell. You can see epidemiological cases down here below. In all, these prion diseases, you have a progressive worsening of muscle control. Once symptoms begin, there's no stopping the progressive decline since there's really no treatment available. The disease can start out with insomnia and weight loss and some memory failure, but it gets worse. The person eventually loses all neurological functionality and can die of infection. It looks a lot like dementia in elderly patients. However, this can happen earlier in life, especially for the variant form of CJD that's transmitted from contaminated beef. There's no treatment available, and it's always fatal. The only way to avoid this is to avoid coming in contact with prions. The last infection I want to mention is an infection of the eye called trachoma. I want to mention it because the infection is covered in this chapter, but we will spend more time on the causative agent in the last chapter we cover. The organism that causes trachoma is Chlamydia trachomatis. the same organism that causes the STD simply known as chlamydia. But you can see from the species name that this important cause of preventable blindness is actually what gives the organism the species designation. This intracellular bacterial pathogen will multiply in the cells of the conjunctiva, and it will result in deformed eyelids and ultimately lead to blindness if it's not treated. It's the leading cause of preventable blindness worldwide, and if treated with antimicrobial on time, you could clear the infection and prevent blindness. But much of the world does not have good access to healthcare and antimicrobials. Prior to the discovery of antimicrobials, having trachoma was reason you would be denied immigration to the United States. The physicians and epidemiologists at the time did understand it was contagious. We will come back to this organism when we discuss STDs, but since it does cause this terrible infection of the eye, it deserves its introduction here. This concludes the overview of some of the important infectious diseases of the CNS. We'll see you in the next chapter.